Introduction. Family-centered care is a practice incorporates the family of a patient to be part of intensive care. The family in this case is the patient's relatives or people that the patient considers closest to him. Mitchell et al. Refer to family-centered care as an innovative approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare patients, families, and providers. Patient and family-centered care applies to patients of all ages, and it may be practiced in any healthcare setting. Family-centered care, therefore, is a collaboration of the nurses and the family of the patient to provide intensive care. This collaboration between the family and the nurses results in complete care for the patient. Below is an overview of the family-centered care in the intensive care unit. The family-centered care. The patient's kin play an important role in critical care. They provide information when the patient is unable to speak and make decisions for the patients. They are involved in giving opinions, assessing, and implementing care. As a result, the family-centered care benefits the patient. The intensive care is based on mutual respect, collaboration, and support for the family and the patient. The family of the patient during intensive care expects that the health providers will notify and assure them of recovery as well as have access to see their relative. Family members who are allowed to assist in giving care ended up with a positive attitude. They assist in giving care even after the patient recovers and is discharged. The patient benefits from the company of the relative. After discharge, the patient has an easier time coping with home care given by the relatives, while the relatives cope easily with the giving care. Furthermore, fewer readmissions occur. According to Gavaghan, family-centered care is the key to an all-round care for intensive care patients. The family receives necessary information in order to support the patient. The nurses, on the other hand, receive support from the family, while the patient benefits from the intensive care. In their study, Mitchell et al. Observed that there are 3 indicators of family-centered care. They include respect, collaboration, and support. Henneman and Cardin affirms that the relatives feel respected if they are given information about the patient. The family cares to know the sleeping patterns, the medical procedures the patient is expected to undergo, and if the patient is recovering. The family also needs to know when to offer help. This is because they are willing and ready to give support. In this case, nurses explain what the family cannot understand, for instance, when to let the patient rest. The family needs reassurance. When there is no hope, the family should be informed that the patient's comfort is important. York found out that health providers have culturally been neglecting the patient's family. While the patient is receiving medical attention, the relatives are left in the waiting area without any information. Centrally to that culture, the presence of the kinsman could have a positive effect. As she further mentions, the family of the patient can alleviate the difficulty of accepting negative results after medical efforts to save life are unsuccessful. Providing family-centered care is a challenging task. A nurse must practice patience when dealing with the patient and the relatives. They should have a positive attitude towards the support to provide intensive care to the patient. Another challenge is the perceptions about the family. Nurses assume that relatives cause the patient to have stress and therefore time given for visitation is limited. The nurses see this restriction as a benefit to the patient. This is because they create time for themselves rather than spend a lot of time in the hospital. Nurses should not assume that the presence of a relative on the bedside is an indicator of their inability to work. Also, patients, on the other hand, should not see the presence of relatives as invasion into their privacy. Instead, they should see it as collective support to assist them recover. Henneman and Cardin argue that the important point to consider is to ensure that the patient's needs are the determining factor of every action. In order to ensure that the family-centered care is a success, there should be some form of regulation. Order can be achieved if there are clearly outlined rules that explain what extent of care the family is allowed to give the patients. There should be a structure that is considerate of the patient, the relatives, and the nurses. This will ensure that care is given at the right time, in the right way, and by the right person. Information booklets or flyers can be availed to the patient's relatives so that there is understanding amongst them. The importance of this information is to clarify doubts and states the do's and don'ts. The relatives could be allowed to give feedback in order to improve family-centered care. Conclusion: family-centered care contributes to the recovery of a patient through combined efforts. The needs of the patient and the family are met while the nurse gets support in providing care. The patient needs should guide the actions in the family-centered care. The end result of this relationship is that the family participates actively in giving support. This and many other essays are available at studycorgi.com.